This video will introduce you to OpenAthens, what it does and why it is worth registering for a free account. OpenAthens is not a database. It is an authentication system that gives you, an Airedale NHS Trust employee, access to a wide range of resources, including journals, over 30,000 of them, databases, a total of 8 that you can search individually or all in one go. Ebooks, we have over 300 of these through ProQuest eBook Central. And we have Oxford handbooks through Oxford Medicine Online. With so much information available online, we often rely on Google to give us a quick answer. This is fine when the stakes are low. For example, if you want to find out the opening times of your local leisure centre, you can go with the first result. And if later you find that the information was incorrect, the consequences aren't going to be too catastrophic. The worst case scenario is that the centre is closed. Disappointing. But perhaps you are doing some research as part of a programme of study, or perhaps you want to identify ways of improving a process or compare different treatment options. You're going to want to find a wide selection of information, and Google isn't going to show you everything. Through Google we have taught ourselves to dip into the shallow end and get out as quickly as possible. OpenAthens allows us to dive deep. The deep web, or the invisible web, is a concept that recognizes that search engines do not index the whole of the web, and that there is a lot of information that they won't link you to. As Devine and Eggersider write, each search engine creates its own invisible web consisting of all the information resources that it does not include in its indexing. There are technical reasons why it is not practical to index the whole of the web. New content is being uploaded and revised continuously. Some websites are deliberately hidden by their creators, perhaps because they are involved in illegal activities. These types of sites are described as being part of the dark web. But another reason why a page might not be indexed is that it is stored within a database or behind a paywall. Although there has been an increase of open access journals in recent years, a lot of published research is still not free to access. Google is likely to prioritize the free stuff or present you with links to pages that ask for payment. There are aspects to Google that are not particularly helpful, especially when looking for research. When you search on Google, you are likely to find that the first 1 or 2 results are in that position because someone has paid for them to be. If you're looking for reliable, unbiased information, then it is likely that you will want to avoid any result labeled with the ad icon. There is also a whole industry around search engine optimization. Businesses pay for advice on how to improve their Google ranking. But how is this going to help you as someone looking for relevant research? Isn't it going to make it more difficult if people are trying to trick the system? One way for website owners to ensure that they get near the top is by having lots of content. This is why online newspapers have blog sections and opinion pieces. It's why they have comment sections. The more pages they have, and the more words they have, and the more combinations of words they have, the more likely they are to have a page that matches your search query. It's also why websites like BuzzFeed exist, with eye-catching content known as clickbait. Essentially, a lot of content is being created just to attract your attention. This potentially pushes information of a higher quality and a higher true relevance further down the list, and that's if it's even indexed at all. Fake news is a problem mainly associated with social networking sites like Facebook and Twitter. A piece of fake news can go viral quickly and spread false or incorrect information. Here are a selection of recent news headlines clipped from the BBC News website relating to fake news. Google includes tweets in its search results, and although there are efforts to detect and remove fake news, you need to remember that there is no requirement for information to be checked before it is published online. If something has been published in a journal or a book, then it has at least been checked by an editor and may have been subjected to a peer review process. One of the main drawbacks of Google is that it doesn't clearly distinguish between different types of information. On your first page of results, you may have a research article, a news article, a blog post or magazine article, a forum discussion topic, and an advert. The ranking of pages depends on a range of factors, but it is heavily influenced by the number of links that exist to that page. This can include links from social media. In this example here, I googled the phrase, "What is the best cure for migraines?" I found the up-to-date summary on page 19 of the results. I did not spot a single link to a journal article in 19 pages. The majority of results fell under the blog post or magazine category. If I had used more precise medical terminology and removed the bias, i.e. the phrase "best cure," then I may have found more reliable information. Using NICE's Healthcare Database Advanced Search, or HDAS for short, will help you avoid all the types of information that aren't going to be useful in a research context. You can also set limits to search on specific types of information. For example, you can limit your search to randomized controlled trials or systematic reviews. You can also set limits based on the age and gender of the patient. Even if you want to find a specific article, HDAS can save you time. Let's have a look first at searching for a specific article in Google. You could type the title using quotation marks at the start and end to search only for pages where these words appear in this exact order. In this example, Google finds 276 results. That's a lot considering you have been so specific. Google is looking for any web page containing these words, so this will include any pages that mention the article, not just direct links to the article. Anyway, you click on the first. This takes you to the abstract in PubMed. There is a link from here to the full text. So you click on that. You are then taken to the publisher's page for the abstract for the article. There is a PDF link, so you click on that. You are then prompted to pay for the article. Stop there. This might be available elsewhere for free. But where do you try next? You could go back to the 276 Google results, or you could try HDAS to see if the article is available through your OpenAthens account. In HDAS, you will not get all those pages that just mention the article. You will be presented with the abstracts and hopefully a link to the full text. If there is no link to full text, then contact the library to request a copy of the article you are looking for. We can try and obtain it from another source. We are sometimes able to find open access articles through other search engines, but we can also request articles from other libraries. It's easy to register for an OpenAthens account. Go to www.nice.org.uk. Click on Evidence Services. Click on Journals and Databases. Look for the box on the left with the heading OpenAthens and click the first link to register. On the form, you will need to enter something in every field. You will need to use your Airedale NHS email address and enter Airedale NHS Trust as the organisation. Enter the postal address in the following format: your department or ward, Airedale General Hospital, Steeton, Keighley, BD20 6TD. At the end of the form, you only need to tick the first box to indicate you have read and accepted the terms and conditions and privacy notice. Then click Register. If you are prompted to select a region, choose Yorkshire instead of West Yorkshire. You will then receive an email with your username and a link to activate your account and set a password. Once you have done this, you will be able to log in from anywhere, not just from within the organisation. If you have any difficulties with the registration process or have any queries about the content of this video or for anything library related, you can visit us or contact us by phone, email or Twitter. We are located in the Health Information Centre between the Education Centre reception and the Education Centre lounge. The Wayfinder location is B11. Our opening times are 9 AM to 5 PM, Monday to Friday. Outside of these hours, you can access the library computer room and study area with your staff card. Our email address is airedale.library@anhst.nhs.uk. Our telephone number is 01535 294412. Our Twitter handle is AGH_education.